I grew up in Toledo, Ohio, went to high school there. Then I went down to Virginia for undergrad. I came back to Ohio for medical school and then did my ophthalmology training in Chicago. My father was an ophthalmologist, and so I grew up with watching him do ophthalmology, and I just sort of followed his footsteps. Growing up as a kid, I could just tell he loved what he did, and initially I thought I'd check other things out. I went to med school, I thought maybe orthopedics or maybe dermatology, but I just kept on going back to the eyes. When I'd come home for break or Thanksgiving, my dad and I would just talk shop, talk about ophthalmology, and he had a passion for it and pass it on to me. What's nice about ophthalmology is it's a great field for improving people's livelihood. People come in with a problem, they can't see, maybe they have cataracts, or maybe they're wearing glasses and want to get out of the glasses and want laser eye surgery. So we have a visual problem that's impacting someone's lifestyle. And we have great technology to be able to treat that. Nowadays we've seen so much advancement. We've seen a lot of advancement in cataract surgery. We now have lasers in cataract surgery and specialty lenses. Same thing with LASIK. I myself, I had radial keratotomy, which is the precursor to LASIK. I had it some 20 years ago, and that was amazing back then. And now I look what we do to get people out of glasses. We have lasers that create flaps. We have custom lasers that can custom imprint, let's say, the contact lens prescription onto the eye to improve vision. So the technology and what we can do for people is truly amazing. I think laser vision correction for both refractive surgery for cornea and for cataract surgery has really revolutionized what we do in ophthalmology. Initially, ophthalmology was basically just dealing with pathology. If you had a certain eye condition, we would try to treat it, but now it's more of a lifestyle field where patients are coming in and want to improve their lifestyle by decreasing the need for glasses or contacts, and the technology we have nowadays for that is truly amazing. We understand having surgery is scary, and particularly eye surgery, so our goal is to make the experience seamless and a pleasurable one. I think it starts with education. We want to educate patients on what are their options. A lot of people think it's just cataract surgery, but nowadays there are options where we can try to meet a particular goal for that patient. Same thing with LASIK eye surgery. Now there are add-on options. There's things like the camera lens or corneal inlays that can give distance and near vision. So we want to basically educate patients so they can understand what they're choosing, what's going to fit their lifestyle the best. There's not necessarily a one-size-fits-all. I think it's understanding what the patient's goals are and choosing a technology that fits their goals.